Okay, this is the in the know in service for preventing pressure ulcers. After finishing this in service, you will be able to explain the importance of healthy skin, describe how a pressure sore develops, name at least 5 bony prominences, list at least 6 ways to prevent pressure ulcers, demonstrate pressure sore prevention techniques during your daily work. A couple of instructions I want to go over. As you are studying this in-service on your own, please make sure that you read through all of the materials that are attached. If you have any questions about anything that you read as you go along the in-service, please call me. This is Latanya at the office. You can reach me at 972-270-2000, and they will transfer you to whichever office I am in at that time. Make sure that you take the quiz at the end of this. As you go through, just make sure you're paying attention to the information you're reading, and then all of the questions are true or false. So, what is a pressure sore? Pressure sores are injuries to the skin and the tissue underneath it. Clients are at risk for a pressure sore when they sit or lie in the same position for a long time. Staying in the same position puts pressure on one part of the body and stops the blood from circulating to that area. For example, if a client sits in a wheelchair in the same position all day long, a lot of pressure is put on the tailbone. The bone presses on the skin and a pressure sore can easily develop. There are a number of common problems that can lead to a pressure sore. A client who is incontinent or who lays on wrinkled linen for long periods, a very heavy client or a very thin one, a client who is confined to a bed or wheelchair, an elderly client since age makes the skin more likely to tear or break down. Remember, the skin is the largest organ in the body. As long as it is unbroken, it keeps bacteria from infecting the body. By providing personal care to your clients, you play a very important role in keeping their skin clean, dry, and unbroken. And healthy skin will help your clients stay as well and active as possible. Watch out. The first symptoms of a pressure sore are heat, redness, tenderness, and discomfort. Tips for preventing a pressure ulcer: keep the client's bed clean, dry, and free from wrinkles. Change the linens as ordered and if they become wet or soiled. Keep incontinent clients as dry and clean as possible. Use pillows and pads to help position clients comfortably in their beds or chairs. Place the pillows so that they relieve pressure on bony parts of the body. Report any changes that affect the client's skin to your supervisor. These changes include dry skin, very moist skin, redness, warmth, tenderness, rashes, bruises, new incontinence, changes in appetite or fluid intake, and complaints of pain or discomfort. Please make sure that anytime a patient has any changes that you are contacting the office, you want to either report that to the case manager or to the director of nursing so we can get that information to the physician. Encourage your clients, if they are able, to shift their position every 15 minutes or so. Explain to them how important it is to prevent pressure sores. Make sure that whenever you're in the home that you're going over the importance of this with the client or the patient and also the caregivers. Make sure that they're understanding that that patient does need to change their position at least every 2 hours, but they can just shift a little bit if they're able to every 15 minutes. Avoid sheet burn by not dragging a client across the bed. Ask the client to help, if possible, or get a coworker or family member to assist you to move the client. Always move on the count of 3 so that you are all working together. Whenever you reposition your clients, use it as an opportunity to check their skin. Keep in mind that you, as the home health aide, will be the first ones to see if a patient does have a skin problem, and we can go ahead and get that taken care of right from the beginning and get a nurse sent out to see the patient. When bathing a client, pat the skin dry with a towel instead of rubbing it. Make sure to offer your clients enough fluids to drink. Unless the client is on a fluid restriction, think of a 2-liter bottle of soda. The average person should drink at least that much water every day to keep the skin healthy. If you have patients that you know are not able to get up and get themselves a glass of water, or they're just not likely to, it's really important that before you leave, if that patient is not on fluid restrictions, that you get them a large glass of water and put it at either the bedside or near the recliner or chair or couch, whatever they're sitting, and just encourage them to continue to sip on that water throughout the day so they would be able to get in plenty of fluids. Help your clients to exercise as ordered, whether it's by walking or by performing range of motion exercises. Physical activity increases circulation and helps prevent pressure sores. Some of your clients may use special devices to prevent pressure sores, including special pillows, egg crates, wheelchair cushions, electronic beds, water beds, and heel protectors. Make sure you know how to use any devices ordered for your clients. If you are not able or do not know how to use any of the devices a patient has, please contact the office and we will get that taken care of for you. If you are ordered to give a client a massage, do not rub any reddened areas. Massaging reddened skin increases the damage to that area. Remember, only nurses or physicians can directly treat a pressure ulcer. However, your careful attention to your client's skin can mean so much to their health and comfort. Also, you want to make sure if a patient does have a pressure sore that we're treating, or even if the caregiver is taking care of the wound care, make sure that there are instructions on the home health aid care plan that tells you what you need to do with that wound during a bath. If it is not on the care plan, please contact the office and either the case manager or the director of nursing will get that added, so we make sure that you do understand what to do with the wound during a bath. A couple of things I want to point out on the points to remember. The bony prominences are the most likely areas to develop a pressure sore. These include the following: bony body parts, the tailbone, the buttocks and the hips, the elbows and knees, the heels and toes, the shoulder blades and inner ankles. Heels and toes, the shoulder blades and inner ankles. You might also hear the pressure sores called stage 1, 2, 3, or 4 wounds, and then you can see below what each stage is. Let's go over the cost of pressure sores. First, just remember that it is so much easier and cost effective to prevent pressure ulcers versus trying to treat one. But a few things we do want to go over. Client discomfort. Pressure ulcers can be very painful and can affect the client's quality of life. Once you start getting down into the stage 3 and stage 4 pressure ulcers, usually the patients don't have a whole lot of feeling in those wounds because especially with the stage 4, it's down to the muscle and bone, so you've already gone past the nerves where the patient would normally have pain. Client deaths. A client who develops pressure sores is 5 times more likely to die than a client without pressure sores. Healthcare costs. The treatment of pressure sores takes up a lot of our healthcare dollars. Think about this: 16 people could have hip replacement surgeries for what it costs to treat the average pressure sore. And then you just keep in mind the cost on the home health side. As an agency, it is our responsibility to make sure that we provide all wound care supplies for a patient. That's whether we're treating the pressure ulcer or if the caregiver is treating the pressure ulcer. So that also increases our cost for those patients. Your workload and time. Studies have shown that it takes at least 20 minutes longer to care for a client with pressure sores than one without, even if both are bedbound. It's much easier to prevent pressure sores than to cure them. Okay, so let's go over some important things preventing pressure sores, the to-do list. And remember, preventing a pressure sore is much easier than healing one. You can help prevent pressure sores by changing your client's position at least every 2 hours. And since you're not in the home for that long, you want to make sure that you are encouraging the patient or the caregiver to reposition at least every 2 hours. Encouraging your clients to move a little if possible in between position changes. So every 15 minutes or so, if they could just shift or adjust a little. Checking your client's skin at every opportunity during a bath, a turn, a transfer, or a diaper change. Keeping your client's skin clean and dry. Encouraging your clients to eat a balanced diet and drink plenty of fluids. Using all available assistance to move your clients to avoid sheet burn, such as an extra sheet, a mechanical lift, a coworker, a family member, a trapeze, or etc. Keeping the bed linens clean, dry, and wrinkle-free. Applying any skin lotion or powder ordered for your clients. Remembering not to rub reddened areas. Reporting any changes in your client's skin, their ability to move, their appetite, their bowel or bladder status, or any complaints of pain. And remember to watch for the first signs of a pressure ulcer: heat, redness, tenderness, and discomfort. Okay, next thing we'll do is go over, um, we'll have a couple of discussion questions. As I read the question, I'm going to give you about a minute or so um, of silence, just for you to be able to think through the discussion question. So the first one, clients who are paralyzed are at high risk for pressure sores. Can you name some of the reasons why? Well, with them, they're not able to feel that, so a problem with their skin can easily occur. Remember that tenderness and discomfort are two of the first symptoms of a pressure sore. If you have clients who cannot feel pain or who cannot tell you about their pain, pay close attention to their skin. Okay, the next discussion question. How do you think doctors came up with the idea of turning a client every 2 hours? Actually, a doctor did not come up with this idea. This 2 hour guideline developed during World War II because that was how long it took the staff to turn all the patients in one ward. While there is nothing scientifically magic about turning a client every 2 hours, we know that it makes good common sense. Be sure to follow your workplace policy for turning clients and to remember how important a changing position can be to preventing pressure sores. Okay, the next discussion question. Which of these clients would you think is more likely to develop a pressure sore? 1. Mr. Smith doesn't have a very good appetite, but he does get up and walk every day. He is incontinent of urine once in a while, but he is confused and forgets to tell the aide when he wets himself. Or 2. Mr. Jones has difficulty moving without help, so he asks his aide to help him move from the bed to the chair several times a day. He uses a urinal and bedpan without a problem and eats a balanced diet. Even though Mr. Smith is mobile, he is confused. It sounds like he might be wet sometimes for several hours. Mr. Smith may not be alert enough to tell his aide if any area to his skin is sore. He doesn't eat very much, which also puts him at risk for a pressure sore. Mr. Jones is confined to his bed or chair, but he sounds like an alert client. He likes to change his position several times a day. He is not incontinent. From the description given, Mr. Smith is the client most likely to develop a pressure sore. Please remember to pay close attention to all your clients. The more skilled you are at looking out for possible pressure sores, the better off your clients will be. Okay, the last discussion question. How long do you think it takes for the average pressure sore to heal? The average pressure sore takes 8 months to heal. However, some pressure sores require skin graft surgery and much longer than 8 months to heal. Okay, so now time to do your quiz. Are you in the know about pressure sores? Make sure that you answer true or false, and then check your answers. Make sure that you get this turn completed as soon as possible, and it will send the information to me. If for any reason you score less than um, a 70, I will be contacting you, and then we'll go over the information, and I'll be able to answer any questions that you have. Thank you.